persistent sore throat, or hoarseness. It could be more than just a cold. Know the warning signs of head and neck cancer before it's too late. Cancer is one of the most challenging diseases to cure, and its success heavily depends on early detection. Among the many forms of cancer, head and neck cancers are particularly dangerous due to their subtle onset and aggressive nature. These types of cancers affect areas like the mouth, throat, voice box, nose, and nearby tissues, and they are alarmingly common in India, primarily because of lifestyle and cultural habits. In this article, we'll explore the 7 key warning signs, risk factors, treatment effects, and essential prevention tips for head and neck cancer with expert insights to guide you. Let's first look at the warning signs. While the symptoms may initially seem minor, they can be early indicators of a serious underlying issue. If you notice any of the following symptoms persisting for more than 2 weeks, seek medical attention immediately. 1. Chronic sore throat that doesn't heal. 2. Persistent coughing with no clear cause. 3. Hoarseness or change in voice. 4. Difficulty swallowing, dysphagia. 5. Unexplained ear pain, often one-sided. 6. Lump or swelling in the neck that doesn't go away. 7. Sudden unintentional weight loss. These symptoms are often overlooked or confused with common infections. However, persistent or recurring signs could indicate something more serious. So, what exactly causes these cancers? The biggest culprits include tobacco use, whether smoked or chewed. It's the leading cause, especially among men. Alcohol, especially when consumed alongside tobacco. Infection with the human papilloma virus, HPV, particularly strain HPV-16. Are you at risk from HPV? Find out here. Betel quid, or pan chewing, still widely practiced in several regions of India. Poor oral hygiene and long-term irritants like sharp teeth or ill-fitting dentures. Our next question is, how do these cancers affect a person's life? The impact can be devastating. Cancers in the head and neck region can lead to significant disfigurement, making it difficult for patients to eat, speak, or breathe normally. The treatment, which often involves surgery, radiation, or chemotherapy, comes with its own set of challenges. How does treatment affect speech and swallowing? Let's find out. Surgery. Removal of parts of the tongue, throat, or larynx can cause significant speech and swallowing difficulties. Reconstructive surgery can help, but full recovery may take time. Radiation and chemotherapy often lead to tissue inflammation, dryness, and stiffness in the muscles involved in speech and eating. What are the supportive care options? Good news, modern oncology goes beyond just cancer removal. Supportive therapies are essential for improving the quality of life during and after treatment. Speech therapy helps restore communication ability. Nutritional support ensures the patient gets essential nourishment. Mental health care and social support help with the emotional toll. As Dr. Mandeep Singh Malhotra, Director of Surgical Oncology at C.K. Birla Hospital, puts it, a multidisciplinary approach involving speech pathologists, dietitians, and psychologists is crucial for holistic care. Can head and neck cancers be prevented? The answer is yes and no. While some risk factors like genetics cannot be changed, your lifestyle choices play a massive role in reducing the risk. So, what can you do to protect yourself? Quit tobacco in all forms. If you're an alcoholic, limit or avoid alcohol. Practice safe sex to avoid HPV transmission. Maintain good oral hygiene. Go for regular medical and dental checkups and stay hydrated. Drinking enough water helps prevent dry mouth, which can lead to bacterial buildup and irritation. Remember, knowledge is power. By understanding the risks, symptoms, and preventive measures, you can take charge of your health. If you notice any unusual signs, don't hesitate to consult a doctor. Early detection and treatment can make all the difference. Now, let's take a moment to acknowledge the elephant in the room. In India, the high consumption of pan or betel quid, often seen as a stimulant and a way to freshen breath, is a major contributor to oral cancers. It's a social norm in many communities, but it's crucial to understand the link between pan and cancer. Educating people about the risks and encouraging policymakers to consider restrictions on its sale and consumption could be game changers in the fight against head and neck cancers in India. Finally, it's important to remember that every individual is different, and not everyone who experiences these symptoms has cancer. However, if these symptoms persist, it's essential to seek medical advice for a proper diagnosis and treatment. Ignoring early signs can be fatal. Head and neck cancers often start small but spread quickly. The good news, early detection can significantly increase survival rates. So if you or someone you know is experiencing persistent symptoms, don't wait. Seek help, get tested, and take action. Your life could depend on it.